Hello, everyone. Thank you for joining us. Our presentation today is titled Advancing Telehealth Policy for the Physical Therapy Profession. And we're joined today by American Physical Therapy Association staff, Kara Gaynor, Director, Regulatory Affairs, and myself, David Scala, Senior Specialist, Congressional Affairs. So telehealth and virtual physical therapy has been a long debated discussion among physical therapy profession. The American Physical Therapy Association, APTA, along with its 100,000 members, have advocated to Congress and the Department of Health and Human Services to expand the Medicare telehealth provider list to include physical therapists. And in 2016, APTA started congressional advocacy efforts for telehealth reform with the Connect for Health Act. This bill would implement a Medicare waiver program that could allow PTs and other providers to apply for a waiver to furnish telehealth, but it was under cumbersome criteria. This bill was not perfect, but APTA believed that if PTs were given the chance to use telehealth for Medicare patients, the data would show positive outcomes. Congress and their staff were critical of digital health and expanding telehealth to the Medicare population. So much of our advocacy on Capitol Hill was educating the staff and members how PT could be performed via telehealth. PTs and APTA continue to bridge that education gap by giving examples of PT via telehealth, including assessing fall risk in the home, reducing the frequency of missed visits, seeing and hearing additional social determinants of health, and providing at-home adjustments to care that cannot be replicated in a clinic. These are just a few examples of many. Most staff and members of Congress are genuinely surprised to hear the ways physical therapy can be done virtually. Yet, Congress seems eager to drag their feet when advancing any legislation. It doesn't help that CMS and MedPAC continually press caution for risks of fraud, negative health outcomes, and ineffective technology. So the push for reform has moved slowly. All of this changed during the public health emergency and the expansion of telehealth to physical therapy services in Medicare. Now telehealth is a prolific topic on Capitol Hill and in the media. Senators and representatives from both political parties have been talking about the positive benefits of telemedicine during the pandemic. And each of the members I speak to say a variety of examples of why telehealth has improved our health infrastructure and patient outcomes. Some members have boasted about the increase of access for military veterans through the VA system. Others say private clinics have kept their doors open by supplementing patients through virtual means. Further, members praise telehealth for giving a choice for Americans to protect themselves and medical professionals from the coronavirus. They also emphasize that telehealth has increased access for the Medicare population who often lack transportation, economic resources, and proximity to care. We've always had members of Congress who have experienced physical therapy for themselves, and these offices are generally the most friendly to our ideas. And since the pandemic, these same members have experienced firsthand the expansion into telehealth and have received PT virtually. They have loved their virtual visits because it has greatly helped their travel schedules and increased their time with their physical therapist. So building on this traction, APTA has therefore adjusted our sights and our legislative priorities. APTA has been actively engaging with Capitol Hill about making the permanent policies expanded under the public health emergency. So we have officially supported two pieces of legislation. The Expanded Telehealth Access Act is our priority legislation, and it adds physical therapists, audiologists, occupational therapists, and speech language pathologists to the list of authorized practitioners of telehealth under Medicare. It also permits the Secretary of Health and Human Services to continue to expand this list. The Telehealth Modernization Act allows the authority of Secretary of Health and Human Services to permanently expand the types of healthcare providers that can offer telehealth. And for physical therapy, this is a step in the right direction, but it would mean that we would need to advocate to HHS in the future to be added to that list. The bill also ensures that patients can access telehealth anywhere by permanently removing Medicare's geographic and originating site restrictions. And this is essential for physical therapy as it allows patients to conduct their telehealth visit from home, which is where the plan of care is designed for. So the COVID-19 pandemic, along with the public health emergency, has changed the telehealth landscape. Physical therapists have been using telehealth for a year now, and we have heard from our members and their patients about great successes. We believe this is the year to reform telehealth under Medicare. Thank you, and I'll now hand it over to my colleague, Kara Gaynor.
Thanks so much, David. I'll spend the next few minutes providing an update as to where the physical therapy profession stands at the federal and state level when it comes to telehealth outside of what is happening in Congress. PTs and PTAs have to ensure that when providing telehealth services or billing for them, they're practicing legally and ethically and adhering to state and federal practice guidelines, payer contract agreements, and liability insurance. We encourage PTs and PTAs to closely review and understand their state practice act and corresponding state licensure board regulations or rules or guidance regarding the delivery of physical therapist services via telehealth. APTA has identified 27 states that have regulation either within the State Practice Act or otherwise that explicitly recognizes telehealth as within the PT scope of practice, and 3 that also recognize it within the PTA's scope of practice. Now, in light of COVID, some states have made emergency modifications to PTs and PTA's scope of practice, allowing them to practice telehealth during the public health emergency. And these modifications take the form of declarations by the governor or by emergency revisions to the Physical Therapy State Practice Act. For PTs and PTAs who are unsure if their state has enacted such modifications, we encourage them to contact their APTA state chapter for guidance on whether their state has issued such an executive order or otherwise revised the state's Physical Therapy Practice Act. Now, under Medicare, Congress granted CMS statutory flexibilities as it relates to telehealth during the public health emergency. Accordingly, CMS expanded the originating site requirements. They amended the geography. They added provider types, including therapists, and they expanded telehealth to include both new and established patients. And then also the HHS Office for Civil Rights is exercising enforcement discretion as it relates to HIPAA. But we still encourage everyone to use HIPAA compliant platforms when providing telehealth. And it's important to note that the temporary flexibility with HIPAA is obviously temporary in nature only, and it's only during the public health emergency. And state law still applies. And many states have laws that are more stringent than HIPAA. So it's important to be aware of what your state requires as well as what's happening at the federal level. Now, with the passage of the CARES Act on March 27th, like I said, Congress granted CMS statutory authority to implement flexibilities as it relates to telehealth. And CMS took that authority and on April 30th announced that physical therapists in private practice could furnish and bill telehealth under Medicare. And then on May 26th, CMS stated that institutional providers of therapy, in addition to private practitioners, also were eligible to furnish telehealth. And this additional explanation came about primarily because a lot of stakeholders, including APTA, quickly followed up with CMS after they announced that private practitioners could furnish telehealth and said, well, this flexibility also extends to institutional providers. And so CMS therefore then subsequently agreed and recognize them as eligible to furnish and bill telehealth during the public health emergency. Now, CMS doesn't have the authority to permanently add PTs and PTAs or institutional providers as authorized Medicare telehealth providers. And as David mentioned, Congress must enact legislation in order for that to become a reality. So APTA is aggressively advocating for permanent coverage of telehealth for physical therapist services under Medicare in the new Congress. And as David mentioned, we're pursuing reintroduction of legislation. However, CMS does have the authority to expand the recognition of providers that can permanently furnish and bill communication technology-based services. And during the public health emergency, CMS recognized therapists in private practice and facility-based therapy providers as eligible to furnish and bill remote assessment of recorded video or image, virtual check-in, and e-visits. And actually in the 2021 fee schedule final rule, CMS stated that they would be permanently recognize these providers as eligible to furnish and bill these services effective January 1st, 2021. Now, beyond Medicare, APTA continues to advocate that PTs and PTAs be permanently recognized as eligible telehealth providers across public and private insurers. In the wake of the COVID-19 pandemic, other health systems and payers have recognized PTs and PTAs as eligible to furnish telehealth, including the Veterans Health Administration, which recognized physical therapists and physical therapist assistants as eligible to furnish telehealth prior to the pandemic. But also TRICARE and the VA Community Care Network, as well as Medicare Advantage plans. And so we do encourage physical therapy providers to continue to monitor what their TRICARE plans, Humana Military or HealthNet, the contractors administering TRICARE, are putting out in terms of guidance, because that guidance continuously evolves. And also to check with each Medicare Advantage plan to see if they've expanded telehealth coverage to include physical therapy during the public health emergency. Now, APTA also continues to advocate for Medicare reimbursement of telehealth furnished by PTs and PTAs. And many states responded to the pandemic by recognizing physical therapy providers as eligible telehealth providers in Medicaid. And we've currently found 26 states where Medicaid reimburses for PT telehealth under emergency COVID-19 provisions. Now, I did also want to mention the following. With the additional flexibilities for telehealth reimbursement under both Medicare and Medicaid, it's prompted the HHS Office of Inspector General to conduct audits and inspections of telehealth utilization. And since spring 2020, OIG has announced that they've undertaken, I think, 7 audits, inspections and evaluations related to telehealth utilization. And so telehealth providers should be aware that OIG, among other entities, including GAO, including other auditors, are closely examining telehealth utilization. And so you want to ensure that the telehealth services you're providing, just like you would with in-person, are medically necessary and supported by the documentation. Now, the Physical Therapy Compact is an agreement between member states to improve access to physical therapy services for the public by increasing the mobility of eligible physical therapy providers to work in multiple states. And PTs and PTAs can apply for a compact privilege if their home state is a member of the compact. Now, in order for a state to participate in the compact, the state legislature must pass legislation that must be signed by the state's governor. And by adopting such legislation, each state agrees to allow PTs and PTAs that have full licenses in other compact states to apply and receive a compact privilege. And so compact privileges allow PTs and PTAs to practice as if they have a full license. And currently 29 states have enacted the necessary PT compact legislation, and 21 states are actively issuing compact privileges. And we do expect more states to pass compact legislation in 2021. Now, the rapid adoption of telehealth coverage by payers, by Congress, by CMS at the state level, it obviously was directly related to the public health emergency. But an uncertain future remains for PT telehealth, and we need the continued advocacy of APTA and its members to advocate for permanent adoption of telehealth across payers, as well as recognition in state law. So to summarize where we'll be going next, obviously APTA is engaged in federal, state, and commercial payer advocacy efforts related to telehealth. And we're advocating at the federal level, as David mentioned, targeting Congress as well as CMS, and working to reintroduce legislation that would permanently make PTs and PTAs eligible telehealth providers under Medicare. Now, we've also been advocating that CMS add physical therapy CPT codes to the permanent Medicare telehealth list in anticipation of Congress enacting such legislation. We're also continuing to advocate to commercial payers to adopt permanent telehealth coverage. Over 90 commercial payers adopted telehealth coverage delivered by PTs and PTAs during the pandemic, and 9 commercial payers have adopted some form of permanent telehealth coverage. And we do expect more payers to follow suit. And then finally, we're supporting state chapters in their advocacy to amend state physical therapy practice acts and to include telehealth in the definition of physical therapy, expand adoption of the PT Compact, and continuing to lobby states to adopt Medicaid coverage and reimbursement, as well as to advance coverage and payment parity laws for telehealth PT. Now, these are just a couple of our resources. I also included a link to the CMS website. And then also we have updated lists that we continually update that outlines coverage of commercial payers, federal payers, non-federal payers, and keep that updated throughout the public health emergency. So PTs and PTAs can keep track of what payers are extending their telehealth policies or what payers may be pulling them back. So I hope this webinar was helpful, and we look forward to your questions.